Is that just like for a lot of queers, they might be the only queer person in their family, so that family occupies a very particular location in terms of identity. The similar things happen with disabled folks, and that most people with disabilities don't have disabled parents. And so finding a disability community and a disability identity is something that people have to do beyond their family units. So in November of 2001, Sharon Duchesnel and Candace McCulloch were a white lesbian couple living in Maryland. They had a baby boy named Gavin, who was conceived by assisted insemination. Both Duchesnel, who was the birth mother, and McCulloch, her partner, or the adoptive mother, are deaf, as is a child they had several years before Gavin. Both Jan, the older daughter, the existing daughter, and Gavin, the new kid that we're talking about today, were conceived by sperm from a family friend, a friend who also was deaf. Now, Duchesnel and McCulloch initially intended to use a sperm bank for these two pregnancies, but what they found is that sperm banks screen out deafness. So their desire for a deaf donor precluded that option. And I want you to hear in that policy of screening out sperm from deaf men or congenitally deaf men, you should hear sort of repercussions or echoes of the eugenics in the early part of the 20th century and ideas about who is fit enough to be a parent. So a few months after Gavin was born, his parents took him to get an audiology test to see if he was indeed deaf. And the diagnosis was very clear. He had profound hearing loss in one ear and severe hearing loss in the other ear. Duchesnel and McCulloch's choice to use a deaf sperm donor comes out of their belief that deafness can often and more accurately be described as a cultural identity as opposed to a medical disability. So their decision to use a donor from their cultural community, and therefore to increase the likelihood that any child that they had would also be deaf, was about this desire to have a child who could participate more fully in their own community and cultural identity. The women were very clear that they would have been very happy with and accepted and loved a hearing child, but they didn't want to accept this notion that deafness is something that should be screened out. A hearing baby would be a blessing, Duchesnel explained. A deaf baby would be a special blessing. So Chambers went to the Rocky Mountain Women's Healthcare Center for alternative insemination, but after 3 cycles of treatment, the clinic informed her that they could no longer work with her because, quote, they had concerns about her ability to safely care for a child. Chambers is blind, and the clinic felt like her blindness posed a threat to the welfare of any future child. So what they told her was that until she could provide an assessment, a written assessment from an occupational therapist that said, yes, she is qualified to have a child, then they would no longer see her in the clinic. Chambers filed suit under the ADA and Section 504 of the Rehabilitation Act, claiming that they were legally discriminating against her on the basis of her disability, because sighted women were not required to provide documentation that they could safely care for any future children. But in November of 2003, the U.S. District Court in Denver found in favor of the defendants, deciding that the clinic behaved appropriately in questioning Chambers' fitness. Chambers' race, she was African American, and her sexual orientation, she was lesbian, may very well have factored into the clinic's decision not to treat her. But the clinic's spokespeople and legal staff and all the media stories focused exclusively on her status as a blind woman. An article in the Denver Post made no mention of her race or sexual orientation, and other news reports on the case followed suit. So given sort of a long history in the United States of seeing disability not as political but as medical, I think the exclusive focus on her blindness guaranteed that the case would be understood by the public, not as a matter of discrimination, but as a matter of common sense and child protection. Their story challenges the feasibility of technological promises of an amazing future in which impairment is cured through genetic and medical intervention, thereby resisting a compulsory able-bodied heterosexuality that insists upon normal bodies.